When is a cystoscopy used to diagnose UTIs? Imagine trying to solve a mystery inside your body. When it comes to urinary tract infections, sometimes the clues are hidden deep within the urinary system. A cystoscopy is a procedure that allows doctors to look directly inside your bladder and urethra using a small, flexible tube with a camera. It's not usually the first step in diagnosing a urinary tract infection, but it becomes very helpful in certain situations. Doctors typically recommend a cystoscopy when infections keep coming back or don't clear up with standard treatments. If someone has multiple urinary tract infections in a short period, it might suggest an underlying problem like a structural abnormality or inflammation that needs to be checked out. For example, if the infections are persistent despite antibiotics, a cystoscopy can help identify issues like bladder inflammation, stones, or even tumors that might be causing or contributing to the infections. Sometimes, blood appears in the urine along with infection symptoms. This could be a sign of more serious conditions such as bladder tumors or other abnormalities. In such cases, a cystoscopy helps rule out or confirm these issues. It's also used when doctors suspect anatomical problems like strictures, diverticula, or fistulas that can make infections more likely or harder to treat. In addition, if a person has symptoms like urgency, pain, or frequent urination that don't respond to typical treatments, cystoscopy can help differentiate between infections and other bladder conditions such as interstitial cystitis or bladder outlet obstruction. From a prostate health perspective, cystoscopy is especially useful for men. Since the urethra passes through the prostate, enlarged prostate or prostate cancer can cause blockages or irritation that lead to urinary symptoms or infections. A cystoscopy allows doctors to see if the prostate is causing any obstruction or abnormality. It also helps distinguish infections from other prostate-related issues that cause similar symptoms. The procedure involves inserting a thin, lighted tube through the urethra into the bladder. It's usually done with local anesthesia and takes about 10 to 20 minutes. During this time, the doctor can see the lining of the urinary tract in real time, looking for signs of inflammation, stones, tumors, or structural problems. While generally safe, some minor risks include temporary discomfort, mild bleeding, or a small chance of infection. In summary, a cystoscopy is a valuable tool for diagnosing urinary tract infections when they are recurrent, persistent, or complicated by other symptoms or abnormalities. It provides a direct view of the urinary tract, helping doctors identify underlying issues that might be causing or worsening infections. For men with prostate issues, it can also reveal how the prostate might be affecting urinary health. As always, anyone experiencing ongoing urinary problems should consult a healthcare professional for personalized advice and appropriate testing.